Symptom measures, a number of standardized self-report questionnaires and clinician rating scales are available to assess the frequency and severity of anxious symptoms. Here, we focus on body-based general measures of anxiety with disorder-specific measures covered in later chapters. Standardized measures of general anxiety symptoms are useful because they provide a broad overview or screening of various anxious symptoms, a measure of symptom severity that is important for evaluating treatment effectiveness, access to normative data so that the relative severity of an anxiety state can be determined, opportunity for repeated administration over the course of treatment so that progress can be charted and symptom clusters identified that have been unresponsive to treatment. Over the years, a variety of general anxiety measures have been developed. The following section presents a few measures that we believe are most relevant for cognitive therapy of anxiety. A more comprehensive review of anxiety measures is provided in an edited book by Anthony Orsillo and Romer. BackInsight Inventory. The BackInsight Inventory is a 21-item questionnaire that assesses the severity of anxious symptoms on a 0, not at all, to 3, severely I could barely stand it scale. According to the manual, the normal range for the BAI total score is 0 to 9, mild anxiety is 10 to 18, moderate severity is 19 to 29, and severe anxiety ranges from 30 to 63. Psychometric studies indicate that the BAI has high internal consistency, alpha equal 0.92, and the 1-week retest reliability of 0.75. The BAI total score correlates moderately with other anxious symptom measures like the Hamilton Rating Scale of Anxiety Revised, State Trait Anxiety Inventory, and weekly diary ratings of anxiety, and patients with anxiety disorders score significantly higher than those with other psychiatric diagnoses. As reported in the manual, the BAI total score means and standard deviations for various diagnostic groups are as follows: panic disorder with agoraphobia, social phobia, GAD, and primary depressive disorder. Factor analyses indicate that the questionnaire is multidimensional with either a 2 or a 4-factor structure. However, only 1/4 of the items assess the subjective or more cognitive aspects of anxiety, with the remainder assessing the psychological hyperarousal symptoms of anxiety. Thus, the BAI is a good measure of the physical aspects of anxiety, especially panic disorder, and it is sensitive to treatment effects, although like most anxious measures, it correlates highly with self-report depression instruments. The BAI is available from Pearson Assessment at pearsonassess.com. Hamilton Rating Scale of Anxiety. The Hamilton Rating Scale of Anxiety, HRSA, is a 14-item clinical rating scale that assesses the severity of predominantly biological and behavioral symptoms of anxiety. Each symptom is rated on a severity scale from 0 to 4, with symptomic descriptions for each item. A cut-off score of 14 on the HRSA total scale differentiates individuals with an anxiety disorder from those with no current diagnosis. The HRSA total score has good internal consistency, inter-rater reliability, and 1-week test-retest reliability, and it has strong convergent and discriminant validity as well as sensitivity to treatment. However, the majority of individuals with major depression score above the cut-off score, so the instrument does not accurately discriminate anxiety from depression. Given that some training is required for the HRSA, the measure could be reserved for cases where a self-assessment of anxiety might be highly inaccurate, in other words, individuals who minimize or exaggerate their anxiety. Depression Anxiety Stress Scale. The Depression Anxiety Stress Scale, DASS, is a 42-item questionnaire with 14 items each assessing the severity of anxiety, depression, and stress. The anxiety subscale assesses autonomic arousal, skeletal musculature, situational and subjective aspects of anxiety. For the DASS anxiety scale, 0 to 7 represents the normal range, 8 to 9 is mild anxiety, 10 to 14 is moderate, 15 to 19 is severe, and 20 plus is extremely severe. The subscale has good internal consistency, temporal reliability, and convergent validity. For example, DASS anxiety correlates 0.81 with the BAI, and DASS depression correlates 0.47 with the BDI in student samples. In addition, individuals with panic disorder score significantly higher on DASS anxiety than patients with major depression, but those with OCD, social phobia, GAD, and simple phobia do not score higher than the major depression group. A shorter 21-item version of the DASS was developed by Anthony, Billing, and colleagues and has psychometric characteristics comparable to the original 42-item DASS. State Trait Anxiety Inventory. The State Trait Anxiety Inventory (STAI) consists of two 20-item scales, with one scale assessing state anxiety, how you feel right now, that is, at the moment, and the other measuring trait anxiety, how you generally feel. With its emphasis on current state, the STAI state scale has greater clinical relevance for tracking the effectiveness of cognitive therapy. Although the STAI has good reliability and convergent validity with other anxiety measures, its ability to distinguish anxiety from depression has been questioned. For this reason, we believe there are other anxiety symptom measures that provide a clearer assessment for the cognitive therapist. The STAI Form Y can be purchased from Consulting Psychologist Press Inclusive. Cognitions Checklist. The Cognitions Checklist, CCL, comprises a 12-items anxiety subscale, CCLA, and a 14-item depression subscale, CCLD, that assesses the frequency of negative self-referent anxious and depressive thoughts along a 5-point scale ranging from 0, never, to 4, always. The content of CCLA revolves around themes of uncertainty and an orientation toward the future, with the majority of items focused on anxious thinking about physical or health-related concerns. Both subscales have good internal consistency, and factor analyzers reveal the expected loadings of CCL items on separate anxiety and depression dimensions, especially in clinical samples. Although CCLA and CCLD are moderately correlated, each subscale is more highly correlated with its congruent than incongruent symptom state. In clinical practice, the CCLA provides an estimate of the frequency of anxious thoughts, especially the physical or health concerns of most relevance to panic disorder. Individuals with anxiety disorders typically score in the mid-teens or higher on CCLA. A copy of the CCLA can be obtained from the Center for Cognitive Therapy, Department of Psychiatry, University of Pennsylvania Medical School, Philadelphia, Pennsylvania.